Good evening, everybody. Welcome. Thank you very much for joining us. I know it's takes away from our home time, but uh, mental health is a very important uh, conversation in our community. I'm the Community and Mental Health Director for We Are One United Innovation. Sorry, drop the innovation .org. And so our work is, I'm going to make it as fast as I can because I know it's only a few of you here. Because on Tuesday I had a large group, and they were very interactive, and it was wonderful to be interactive because this conversation really needs input, and we need to be free to talk about it. Because more we talk and talk about mental health and issues that we personally have experienced, or our emotions, feelings, and behaviors, um, we are able to take the stigma out of mental health and be have honest conversations. So my first slide is um, a very interesting slide of uh, technology, and this what we are trying to do is base our mental health programs on harnessing and gathering technology to close gaps in the work we are planning to do in our communities. Please feel free to, Candace and Julian, please feel free to talk. Tell me what, if you have something to share, just raise your hand, and because it's important to know your thoughts and feelings too. Um, so when we talk of mental health, we look at crisis. So I have crisis, 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 and more we think of a human as a commodity, we tend to look at keeping them in crisis and not using the process of healing, and in a positive way. So we see lack of, when we look at the gaps, we have lack of opportunities for intervention, recovery, and rehabilitation. I think rehabilitation gets the least amount of finance money or interest because we like to send them back into the circle of crisis. Any thoughts about it, Julian or Candace, about crisis?
I think that was a very good point that we often want to keep people in crisis so that the recidivism, the return is greater than, like you say, the healing. And I think we should be more of in the business of helping people heal and recover and be fully rehabilitated to maneuver through life. It gets tough for all of us, but for the grace of God, there go I. So yeah, we need to focus more on healing and showing people that there is life after crisis, crisis, crisis.
Mhm. So we have to look at resilience, right? Why are we so fragile at this stage? Today, young people are very fragile. Don't you think so?
Yes.
I myself can share some a crisis I had, that maybe this is why what I'm doing today is because of this crisis. I'm originally from Sri Lanka, a little island off the southern coast of India, and when I was growing up, when I was about 22, 16 actually, I was faced with a war, and my ethnicity was the perpetrator of the war, and I didn't understand this, but I knew people were going crazy. And when emotions of anger start flaring up, we do ridiculous things, and we, um, um, we know. I witnessed my aunt who had gone to her classroom. She was an English teacher, in a little village, and when she went into her classroom, her whole class had been assassinated because there was an uprising of students. She came home and she hid under her bed, and she never recovered. And I can remember as a little girl, my mom going and praying with her and bringing the priests and doing whatever she could to heal my aunt. But my aunt's life was, she had checked out. she could not recover from the crisis that what she underwent. And today it's so common. Each of us have our own crises. No one has a perfect life. But how do we build resilience in our communities? Candice, would you like to share anything, or Julian?
I actually would love to. Thank you for sharing that too, because that's very powerful and meaningful in your experience, in your aunt's experience. I believe that is important that helping people to understand crises will come, but crises aren't forever. How to actually understand and expect that crisis will be there, will happen, but actually building the skills to face, feel, and deal with them in a way where they can do it independent as a skill set.
Mhm.
That's important. Some some steps to really look at how we can do that, because that's really an empowering people on a grassroots level to understand challenges and traumas will happen, crises will happen, but we're getting through them and getting with some support and help how to do it, how to work through it, and be more resilient and reliant.
Mhm. Yes, yes,
Yeah,
thank
it's
you.
perspective.
Mhm.
In a lot of cases, it's how we help people to maybe change their perspective of what they're going through.
Yes, the
Maybe
shift.
give them a shift of mindset is very helpful.
Yes, so and this generation seems to be very fragile, right?
Yeah,
Would you
indeed, they are very fragile. They can't take much.
Mhm. Yeah. Um, yeah, funnily, I have to share this story. When I was growing up, we would get a caning from our mother and father if we did something wrong. And which is nothing seriously wrong, but that's how they disciplined us. But we still love them. But shifting now, can it do that?
Oh
Why?
yeah, well, we came up in a whole different generation. I mean, I'm of an age where corporal punishment was still in my home. If you did something, mama was gonna make you go pick a switch off the tree, um, and you better pick a good one because her choice was going to be something you wouldn't be happy with. But these children nowadays, if you raise your voice at them, they want to cry and their feelings are hurt. And yeah, it's something that we really need to address in them, give them a little backbone, some ways of thinking about things more joyful, because joy brings strength. And these kids are so sad. They're just sad and serious about everything. And
Mhm.
if they could just find a way to focus on what they have instead of what they don't, and really focus on somebody else's issues. A lot of times people are so focused on what's going on with them that they don't realize that, hey, there are other people going through something that you might be able to help that need if you just come out of yourself for just a moment. So maybe that's something that we can implement to help some of our people that we're going to be addressing.
Yes, yes. Thank you for sharing. Mr. Epps, do you have something to say?
I was going to say, Candace, can I ask you, and since it's just an intimate little group of us here, Julian, what do you guys think would be some strategies that you think you'd like to see us try to implement? What are some ideas you might have?
Well, fellowship is always good, gathering, getting people together, and especially with young people, giving them an ear, giving them some type of forum where they know that they're being heard and that they're being seen and that they're being addressed. Food always brings people together. So, potluck, pizza party, whatever the case may be, but somewhere where we can actually make actual contact with them and look them in the face and say, hey, how's it going? What's happening in your life? What's going, because I go to school now with a lot of young people. I'm much older than all of the students at COD. And I pay very close attention. I'm a people watcher. And I see that these young people, and I can call them children because I think I'm qualified, but these children are just hurting for lack of attention. They don't have any attention. No, they think no one cares. And really, in fact, there are those of us out here who really do care. And I would be very interested in sitting down and taking the time to listen to see where we could find solutions to their problems that they think that there are no answers for.
Yeah. Yes. Thank you. Thank you for that. That's such an important conversation that we have to learn to listen and, come together to share these moments with each other. So this group on Tuesday I spoke to was so different, but I'm just going to run through these slides. So we know Maslow's theory, theory of hierarchy. Most important thing is in our psychological needs of air, water, food, shelter, clothing, and once that is achieved, safety needs, personal security, employment, resources, health, and property, love and belonging. I think this is a big void in our communities. Love and belonging, friendships, intimacy. I just came back from a blue zone meeting where they said that people have only 1.5 friends. Can you believe that? 1.5 friends, and half that friend is the social media. So that is
Now
really
that's just
sad.
sad. That's just sad.
Isn't it? That we can say that that's what the statistics are saying. We have 1.5 friends. So then it's a self-esteem. Again, I think this is very important, learning to give our children the opportunity to build their self-esteem. And as parents, this is being very mindful of how you keep your home safe and how you run your home or how you raise your children. And self-actualization, this will come when all these needs have been taken care of. We start using a different consciousness to look at how we run our lives and how we face issues in day-to-day in our day-to-day lives. Next slide is on ethics and laws. We are One United. It is very important that our CRCs observe these ethics and laws. And I'm sure you know what our Mr. Epps, can you tell us a little bit about ethics?
Well, I think the simple way that I always think about ethics is doing the right thing.
Right.
The problem is very few situations it's simple to know what that is. And so the study of ethics tries to look at each situation and tries to weigh all of the factors to try to come up with what works out to be in the best interest of the most people. That's very difficult. I mean, I think a lot of people, if you are trying to figure out what you would do in a situation while you're in the middle of a crisis, it's too late. You have to really have conversations and talk about this beforehand and really prepare yourself. John Maxwell says, once you're in the middle of something, it's too late to really try to decide what your ethics are. You have to sit down and think about it. As an organization, what we've done is we've identified our values, and our values help us as we try to make these kind of ethical decisions. But even there, we're different people, we have different experiences. And so it's a constant ongoing thing. But I think the benefit of it, of talking about it, even in a conversation, is to get people to start thinking about it, because too often the other side of this, which is laws, which sometimes some laws are good and some laws maybe not as good. And so you have to have both. You can't just have laws, because sometimes that won't take you where you want to go. And without laws, you can't really enforce the ethics. So they work together a little bit. I don't know if that was
Yes,
made any
definitely.
sense or
Mhm. Yes. So ethics and laws. So that's a great description of laws. What is right and what's wrong. Um, and with our laws, I just focused on the laws that our city is run by, and one is the Brown Act, the Public Records Act, the Political Reform Act, Government Code Section 1090, Bagel Keene Amendment, and the Letterman Act is for disabled populations. Mr. Epps, you had a very interesting story. You talked about the Brown Act. Would you share it with us?
remember. Oh, sorry. I don't remember which story.
The Brown Act, the process.
Well, I don't remember what I said before, but I'll talk about it for a second. The idea of the Brown Act is to ensure that government is in the sunlight, that people know what decisions are being made, but sometimes it can be really, for lack of a better term, a little crazy. And I don't know if I told this story or I heard this story recently from somebody else, but they were part of a group and somebody says, well, can I attend a meeting from home? Because, I'm not going to be able to get to a public venue. And what the person explained to them was because of the Brown Act, if they had that meeting and they participated from home, they would have to post publicly in their community that they were having that meeting and invite public comment on the meeting from their home. So, I mean, I don't think the law was intended to do that, but that's one of the strange things that can happen, because of the act. But again, part of it was to try to protect public interest. But on the other side, some people abuse it. I've seen people. I remember Jilska when we were at the city council meeting, and the guy got up and he was like, well, I'm against whatever We Are One United is here for. And we hadn't even talked about anything yet. It was just, he says, I just vote that I just want to tell everybody that I object to who you are, what you do. And we were like, he doesn't even, and he was sitting right in front of us in a row. So there's an awful temptation to kind of reach forward and kind of pop him in the back of the head. But, it's I didn't think I remember that, but that was just a little odd. So it's a well-intentioned, and a lot of laws are well-intentioned, but unfortunately, sometimes there are these kind of side effects that negatively affect people. And for people who are underserved, for people who have mental health problems, sometimes those things actually wind up becoming barriers to them getting the services that they need or being able to feel comfortable talking about what is really wrng with them. So I don't know if that's what you were looking for, but that's what came out this time.
Yes, of course. And, again, I don't know, I have to tell you, I've traveled quite to many countries, but somehow in the United States, we have laws and we have freedoms and we sometimes take these things for granted here. And, at least we follow these laws. Most of us follow these laws, right? So it's very important we as CRCs that when we go out into these communities that we adhere to these laws too, where you have to apply for a permit if you want um, uh, to uh, you know gather in a group. There is a process that you have to follow. So we need to I think in our office, I will be able to put all these laws together in a binder so that people can freely go through them and understand them better. I kind of have learned these laws because I have thrown myself into sitting on different boards, and this was one way I learned these laws, and it has always been with me since that, being in that special place where as a board member. So let's go to the next slide. Uh, Young and homeless. We find that many of our youth are aging out of foster care, from the foster care system, and the, and these are the reasons that they have been incarcerated. So each year, 1 million young people become involved in law enforcement and the justice system. In some cases, this involvement may be due to lack of shelter and other necessities. This can sometimes occur when a young person is arrested for a curfew violation due to the lack of a stable housing, or when they are arrested for theft, for stealing food or money to buy food. In other cases, youth who are arrested and released either through a division program, the diversion program, or after spending time in a juvenile detention facility, may experience homelessness because they are neither unable to return to their families due to restrictions imposed by landlords and public housing authorities, or because families are unwilling or unable to have young people return home, return due to family conflict. Now, we had a case like this um, on Tuesday, and I was able to call a friend of mine who's working in Section 8, and she sent a list of homes that are available, one-bedroom apartments in Palm Springs and the surrounding areas. And so there is a clause that if you put student on your Section 8 application, you will not get a home. So because it's more on the income you get, and students need to be in a boarding situation. That's what she made me understand. So she told me, please don't let him put down student because he'll never get, they'll cut his name off the list. So these laws and these policies need to be revisited because we have a large group of young people who are coming out of foster care, and they have no stable environments to live in. Anyone likes to share something with us?
Yes, Julian. I worked up north in Sacramento area, and I did CPS and foster care agencies. And yes, the aging out process going from 18 to 25 for the youth, it was slim to none as far as resources, housing, or job training. So it was a struggle, and sometimes it's hard to convey to the youth who are already in crisis that the resources are limited. So going to crime or prostitution or whatever they feel they have to do uh, seems like a viable option for them. So it's important that we try to support them the best we can, not best, but support them and really empathizing with where they're at and how to help them navigate that system.
Mr. Hibbs, could you speak for a moment? I just need to go and get my charger because my computer has
That's
7%.
no problem. That's
Okay,
no problem. You know, Julian, as I listened to you, while we were doing this presentation and actually had this slide up on Tuesday, was when we were made aware that one of the people who was actually in the room is in this situation. That's the young man that Jilska was just talking about. And I think there's two things that we kind of see. One, it's really takes a village, right? It takes all of us trying to work together to help someone. It's not always possible for me or you or any one person to help this, but if we work together, we often get a better result. Not always the result we want, but a better result. And I think the young man recognized that we're not going to be able to solve your problem, but what we can do is help and give you what we have, what we can do. But, this is a long-term change that has to take place. I think part of what Jilska was saying earlier about policies and procedures. And so two things. One, we are, as part of our programming, offering job training and some career development and things like that for young people. And that's why we're having a career fair at Palm Springs High School. But we also want to do a summer youth program this summer, where we can give people a stipend at the end of their program so they have something at the end of the summer, go back to school. Because I remember growing up, that helped to encourage me. And I think when you talk about that mindset that they have to have, it has to be one that's focused on, opportunity and not so much focused on what they don't have or how bad the situation is, which is not to in any way try to belittle the situation, but it's just, when you put your energy in to just focusing on the problem just feels like it gets bigger. When you put your energy into helping someone else with their problem, which is what I think I heard you say earlier, Candace, then you open them up to, start recognizing that this is not as bad, or this is not the worst situation I could be in. I just think our job at We Are One United is to help build up that kind of thinking that says, if we work together, we can make this change, but recognizing that it's not going to change quickly. That, all of this didn't get this way overnight, and we won't be snapping our fingers and making it okay for tomorrow. And sometimes that's frustrating for us as caregivers. So one of the things we try to do also is make sure we take time to check in ourselves, because it's real easy to kind of, I almost think it's almost like stress is contagious, right? Somebody else is going through it, and then before you know it, you're feeling it. You didn't know where it came from. So we'll be doing a lot of work, I think, just with the parents of the youth, with the community around. We're looking at how can we help youth regain kind of the trust of the community, as much as the youth feel like the community has let them down. In some ways, a lot of people in the community feel the other way. So how can we work so that both feel like it's valuable, it's important to be together? And that's a big part of what I'm hoping you guys, as part of our community resource team and our staff and the leaders we work with and partners we work with, can help us to change that story, that narrative. So I'm gonna flip it back, Jilska. It looks like you might be plugged in, and
Yeah. Well,
all right, I'll let you finish
so
up. Please.
thank you. Thank you
Didn't
for
mean to
sharing.
talk that much.
Thank you. That was really great, important information, because as we go into these communities, we also have to do our due diligence of finding out all this information that may help us and may close a gap. Like example, I have to tell you, because I live in this community, I get calls about, parents whose children have overdosed on drugs and things like that. Now, if your child overdoses and you take your child to an urgent care or to a crisis center, you are going to get a bill. So what you should do is, actually, this is what they want you to do, is if you have a crisis like someone has overdosed, you call the hotline or you put their child on the street, and then that child becomes homeless at that point. Then the police come and pick the child up and we take him to a crisis center.
Mm.
Then Medi-Cal kicks in. Now, how, or very often, there's so much emotion involved in this process that it's impossible for a parent at that point to even do that. Candace, do you have anything to say about that? Any feedback? Or Julian?
Yes, because I do deal with quite a bit of 60s and 50s, and so this is a real reality, because what happens is the hospitals, as soon as a person don't have a place to go and they can't provide for their food, clothing, shelter, or medical, they're declared gravely disabled. So they're able to access resources. A lot of times, families will do it if they're tired of that individual continue a pattern of behavior. But initially, if they're in crisis, families struggle with, okay, how do we get this person help without incurring massive amount of debt medically? Because that's what happens with families who can't afford, who don't have medical who can cover it. So it's a tough situation, and it's emotionally draining for all
Yes.
involved.
Yes.
Yes. And again, if you work with the disabled populations, you have to realize that, okay, if you are, we say, my specialty is blindness. So if you have an eye disease and you are losing your sight, the most important thing is to immediately register with the Department of Rehab. But now you are under the protection of their laws. So that happens. No, the employer has to modify the work environment for the employee. So if you don't know these things, you will, you will just give up a job and sit home and get into depression, and 2 years later come out with no job, no everything. And so these things have to be talked about. We have to, providers need to talk about this. And we as CRCs need to go out and find out more. What is the process of, if you file for disability, or if you're giving up your driver's license, yes, you have to go get a doctor's note, and then there's a process. Then you go to the Social Security office and report that too. So these are processes that we have to do. Now, very often now the doctors do charge $25 to fill out paperwork now these days. But again, you need to know that. Otherwise, if you have a fixed income, you know, you're going to be looking up and you're going to be very angry. So again, we have to go out and find out our own processes and policies of how we move through these mental health hurdles, I must say. So let me go to the next one. The problem, young people aging out of foster care, we talked about that. 70% will be on government assistance programs, 50 will be unemployed, 50 will experience homelessness, 25 will not have completed high school, less than 12% will have earned that college degree. So results in 1 million economic burden to the society for each young person. So that's a big thing. And we see, as even providers, as mental health providers, we keep diagnosing these children with ADD. Then we say, if you come and see me, I'll slap you with a diagnosis of anxiety. If you have 5, if you don't sleep, if you don't eat, if you cry, if you have racing thoughts and something else, 5 things, I put down anxiety. Next time you come and see me, I'll give another diagnosis of depression. And then this keeps building up. So what are we doing to our young people? We are slapping them with these diagnoses, and how do they, once you get schizophrenic or psychosis or something like that, how are you going to enter the workforce? So there's a large group of young people who have dabbled in drugs and who I don't know how they are going to survive in moving forward after the pandemic. So that's a big burden to everybody. So I think these things we need to revisit, and as we as advocates need to kind of represent our cities and our districts and our communities and advocate for change in policies and processes. So we are One United are looking at this collective impact model where we use a collective impact. We create large scale change. We share agendas. We share measurement systems, mutually reinforcing activities, continuing communication, central infrastructures. Now, today I just came back, like I said, from the Blue Zone meeting, and we are all trying to change these communities, but sometimes we are recreating the wheel, right? So we need to partner. We need partnerships, and we need to just step out of our zones and create these partnerships and collaborate. And it takes each and every one of us in our teams to do this. So I had shared agendas. Again, after the pandemic, lots of places have closed, I find. But I think we as CRC teams, we need to start visiting each of these places and having these experiences with these groups that are rehabilitating and working in mental health and working with our youth, so that these are areas, these are places that we can send our children to, or our youth to, or adults to, in place in time of crisis. So I just listed a very few, but again, after the pandemic, lots of them have closed down. So we need resources. No, so we are looking at gathering data from HARC and ESRI to do our quantitative and qualitative evaluations, so that we can find out the whys in our communities. Why are we having so much of? Why are children not going to school, or why are they not having a roof above their heads? Or all these questions can be answered. Mr. Epps, do you like to talk about a little bit about this, about the measurements? No? Okay. Moving forward, I think this was more to on our opioid epidemic. These are just slides of, working with youth. We need to educate them on, smoking weed, how it enters your body, what happens. Now, there are two sides of this story, because I have to tell you, as a provider, I do have clients who take the purified oil. Especially, I have a little baby who has a frozen optic nerve, and it's actually, this child had she was born with so many seizures, but now, because she takes the purified oil, she is healing. But so there is an important of medicine in this, in the marijuana. But again, when you smoke it, it enters your brain in very different way. So this was just a slide to bring this conversation out, hopefully. Here, if these neural pathways are broken down with fentanyl use, and the kids, they keep taking all this, the drugs, from weed to Ativan to oxycodone to heroin to fentanyl. So what happens to your brain? So and there's this QR code that ESRI did, where you can actually find out stories of people who actually were victims of drug abuse last year and who passed away in our communities. So again, brain functions, this is very important for you to understand what parts of your brain gives you rationality, and your socialized behaviors, your motor functions. Just educating them on these conversations is, I think, very important so that they have more clarity on um, the mental health aspect of what we're trying to do. Again, this is, I put this together because to me, the waste of resources, when there's a crisis, we, we call the police call the fire department calls the paramedics. And soon you have 12 people working on this one person. So there's a lot of waste here. So again, technology is going to help us close these gaps, hopefully. Because I think we have to have a different model of how we are going to service um, our people who have mental health issues in our communities. So our community priorities is to reduce the stigma through social media and education and awareness, using technology for greater access, telehealth, teletherapy, psychiatry, accountability and transparency in recovery and rehabilitation services, integration and coordination among service providers, ongoing collaboration training for healthcare workers. Anyone has anything to talk about here? Julian, Candace?
No,
It's a
you're
lithium,
good.
brand new lithium battery, but I left
No,
shoes on.
you covered it very accurately and clearly. So because I do work with youth, and they love to run a vape. They want to smoke their cannabis vape, and or they take the prescription meds. As
Who's this?
so it's different. So they're seeking it because the brain and the body emotionally is actually becoming attached to it
Mhm.
in such a alarming way. Alarming.
Yes. So again, when I went for this blue zone meeting, so they are talking about, going back to health and wellness, like Loma Linda, where they have a green zone. And, this is kind of common sense, isn't it? To eat and take care of your own body well. But now we have to teach these things. We have to teach these skills to our youth and to these generations. So again, I think Mr. Epps is very most welcome for y'all to be creative, how you'll approach this with communities, and he also gives you the power to go out there and make your own programs and teach the youth and use different health and wellness models to bring these conversations to your community. So I think that is wonderful. So our next gen project, which is something we are all looking forward to, is our AISRE grant. And with this, we started with, during the pandemic, we started with our community cafes where we had simple conversations with our youth on branding, marketing, money management. And this was very powerful for the youth who took part in it. Moving forward, I'm looking at starting my circle of friends, which is like a focus group, on the 24th on Friday next week. And hopefully I start a circle of friends, and this circle grows to be 35 circles probably by the end of the year. This way we have a good support system in our communities, having simple conversations. What do y'all think of this idea? Candace?
I'm just reading all of the things that you're offering: community cafes, virtual cafes, ongoing circles of friends, focus. I think that's excellent. Focus groups. So they're starting on March
24th. Oh, sorry. We had yes.
And so they're going to start on the 24th. They just said the 14th on here. I was just misreading.
Yes, I'm sorry.
Yeah,
we were planning to start on the 14th, but now we'll be starting the 24th because
Oh, okay.
we had a little hiccup with the place we were meeting at. But I think I've got 7 people who are ready to join our circles of friends. And I think this is going to be a wonderful group that will grow in our communities. Again, it takes a village to raise a child. So let's all take part in this village, right? We have been too silo in our doing things. But funnily in Sri Lanka, when we wake up in the morning, we open our front doors, and then people come, sit down for lunch and dinner, and so that's life in that part of the world. But here in this country, what do? We get up, we shut our front doors, so no one comes in. Okay, so hopefully we can change. We can become a community where we are kind of a resource to every neighbor, and we are more ready to help each other. So hopefully we are one united. Will shift our neighborhoods in a positive direction. Then the parent learning walk is actually with the school districts, taking kids who are out in crisis, who are not completing school, and working with the parents and actually having a good conversation, looking at the child's strengths and guiding these children into um, careers that will be sustainable for the future of their community. Then Coding on the Road is another program we are looking at starting for our youth, which I think is wonderful because um, this, when you look at crisis behaviors, I think these personalities work really well in coding and building towers and scratch boards, and that pathway is very good for them. Then our focus groups. Again, we have not started our focus groups, but we will be starting our focus groups in a few weeks' time. And the last one is the children's desk. So this is another next gen project. So we want to harness technology. So the technology database portal that we use natural language processing to identify childhood and adulthood resources, information from recognized databases, allowing users to research and access a variety of childhood or adulthood education resources all in one place and community-based threads. So this is really important as we move into becoming smart communities, that we have this information at our fingertips. This will be wonderful when we have set up our portal, our technology-based portal. Again, this is an interactive solution of what we are planning to do. So let me move through this slide. So breaking the silence, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental health is the result of emotional responsibility and accountability. This journey is made up of spiritual, physical, mental, and social health and wellness. If you get into the habit of using skewed perceptions, dysfunctional relationships, and personal clarity clouded judgments, at any time we look to another to change, we put ourselves in a victim role and weakens our well-being. So I think all of us, each of us, have to take a personal look at what we want of our lives and live a more purpose-driven life. Creating a safe space, again, as CRCs, is very important when you go into the neighborhood, learning to listen, to observe, to understand, focus on what is being said to you, ask open-ended questions, be aware of your own biases and values, use clarifying questions or statements to check out your perceptions. Do not judge. Do not insist on having your last word. Be mindful of the agreed upon goals for conversations. Have your resources ready at hand. Um, this I'm not going to use now, but I must tell you, if you ever get a chance of listening to William Ury, he's a anthropologist from Harvard. He does the Abraham Walk, and it's a wonderful TED talk. And he tells you all, his advice is always go to the balcony and look out of what, and look at what what decisions you're going to make, what judgment. And I think if you do have time, please watch his TED talk. So with that, I'm going to end. Mr. Epps, over to you.
Great job. I mean, no, I think first of all, I want to thank Julian and Candace for being here tonight. I think it has been excellent. I look forward to working with both of you. Candace, we're looking to start doing some work with the young people after school in a kind of planning and service program in April, beginning of April. I want you to meet with our youth team with Kathy Giles and Angel and those guys so that we can kind of get you engaged with that program. I think it fits what you put in your goals. I'm very excited for having you as part of the community resource team. And Julian, I'm just really looking forward to us having the opportunity to work together and get your new organization off the ground, but also have you as one of our partners. But again, Jilska, wonderful. I like that last slide. We probably need to get that printed up just so that everybody keeps it in their back pocket so that as they go out, they can remember those things. I like you, Yuri. One of the things we'll be doing down the line is a few trainings on negotiation, facilitation, and mediation, and what those things are and how they will help us as we are trying to bring about a change in the community. So I'm glad that great minds think alike, and you pull him out also. Vladi, I want to thank you for helping us technically tonight. And if there's no other comments, I would just like to again say thank you and good evening. Anybody have any comments before we go?
No, I'm just not much help needed. Everyone did great. So thank you for everyone sharing their stories. And you too, Jilska, and Julian and Candace. It was great to hear. Not
Thank
good
you.
to hear, not a good thing to talk about, but great to learn from.
Yeah, you don't have to have a lot of people to have a good time.
Right. I just want to say thank you guys for this opportunity and really having the communication and mindedness to really do this and really have a discussion how we can best support our communities, because they are in dire needs of it right now. So I just want to say thank you.
Yeah, I want to do the same, and thank you to Jilska, is that how you say your name? For sharing your story. I found it very inspirational. Thank you so much.
All right, everyone.
Thank you. Listen, good night.
Enjoy your night.
Yes.
Good night, everyone.
Good night.
Bye.